Good morning. Hi guys, I'm Dr. Carolyn Zuiker, pediatric physical therapist here in Austin, Texas, and owner of Boost Babies. So, welcome to Instagram Live again. Happy Friday for those of y'all who are keeping track. Anyways, this morning, I wanted to give you guys another introduction to infant massage. So we are going to be going over infant massage, including the neck and the back. And then we're going to discuss some ideas on treatment techniques behind Torticollis, including some exercises, and then open it up to some questions and answers. So we're gonna go ahead and dive right into the infant massage section. So good morning, as I talked about last week, when you do infant massage on your baby, you definitely want to be skin to skin. So have a blanket handy to cover up the parts of the body that you're not working on at that time. Also, if you use a lubricant, I suggest something natural, like something you can find in your cabinet. Like I like to use coconut oil. It's really gentle on the skin. A lot of parents like to use olive oil. Just try to avoid mineral oils like Vaseline. All right, so let's get started. So we're going to start with the chest. And again, I'm going to demonstrate on my infant doll here. And if you guys have your babies, please go ahead and do it along with me or take notes, okay? So I always tell parents, look at your positions. If you set them up on the floor or on the couch, make sure that you're straight on with your baby. I'm going to be facing a little bit out so I can explain it to you guys a little bit better, okay? So we're going to start with the chest, and you're going to start with your hands together right on the chest bone, right on the sternum, okay? So you're going to have your fingers together here, and we're going to move up towards the shoulders like this, and then out towards their hands, and we're going to say hello. This is called a hello stroke. So again, hands in the middle of their chest, up towards the shoulders, out towards their hands, saying hello. And this is a great time to engage in midline. So you really want to be in there with your baby. Hands go up towards the shoulders, out towards the hands, and say hello. And you can give them a little bit of a tug on those hands when you do that. Again, when you do infant massage, you want a good pressure, not too hard, not too soft. So I like to lay my hands down and then just push in a little bit so you can feel that skin moving underneath your fingers when you do this, okay? And you want to repeat the stroke about 3 to 5 times. So that's the first hello stroke on the chest, okay? Next is a heart stroke. So again, we're going to start right there in the middle of the sternum, or that breastbone, with your fingers together like this, using the pads of your fingers, and we're going to make a heart shape. So we're going to go up towards the shoulders, we're going to go out towards the outside of the shoulders, down the sides, and then right under the rib cage to make a heart. Okay, so let's try that again. So right in the middle of the shoulders, right in the middle of the breastplate, moving up towards the shoulders, down towards the sides, underneath the rib line, in the middle. So that's a heart. Again, let's do that one more time. So these strokes, again, 3 to 5 times. So that's forming a heart. And I really like when I do this, when I get up into the neck, to really kind of pull those neck folds out, because sometimes those can get really crusty and we don't think about touching those and moving those as we do this heart move along the neck, okay? And then when you pull in on the sides, I really like to give a nice pull to those ribs right into the middle like that, okay? The last move on the chest is a X. So think about an X going across their body, and their sternum, that middle part of their sternum is the middle part of the X. So again, you want to use this part of your hand right here, kind of the pads of your fingers and the bottom part of your fingers right there to make the X. So you start all the way down at the hip, and you go to the opposite shoulder across, and you tuck into that shoulder, and I like to give a little bit of a tug down when I do this. This is awesome for opening up the neck. So again, you start at the left hip, and you move up towards the right shoulder, pulling down on the shoulder, opening up that neck, okay? And then you're gonna follow up with taking your other hand, opposite leg, towards the opposite arm, shoulder here, so you guys can see, and pulling down here, okay? So again, you're making that X. So when you do this complete movement, it goes across the body down, glide across the body down. So you're making that X. So you want to repeat this 3 to 5 times across, okay? And this again is awesome for feeling all those tight neck muscles and getting in there and opening up those folds in the necks and the creases in the necks, okay? So that's how we massage the neck. And next is the back. So the back can be a little tricky on positioning. You really want to have both hands free. So you can use a boppy pillow, you can use a regular pillow in your lap to help with positioning. If your baby's a little bit bigger, I always had really good results by tucking my baby in kind of a kneeling position and placing my baby along my lap, along the outer part of my leg with the hands underneath like this, kind of like a modified tummy time position, okay? So you have both hands free to work on the back. So with this, again, we're gonna start with just laying our hands, so make sure you have your lubricant in your hands ready to go, and you're gonna just do a nice glide from the top of their shoulders down towards their bottom. And again, top of the shoulders down towards their bottom. So this is just an intro stroke, so it's nice and light, and just a glide, getting them used to your touch, getting them used to the touch on your back, okay? The next stroke we're gonna do is a little bit more of a friction massage where we're gonna go back and forth with our hands down the back, okay? So we're gonna start up again at the shoulders, moving all the way across the back. And you really wanna feel that skin moving underneath your hands with this one, okay? So again, 3 to 5 times for each stroke, going back and forth. Good job, you guys. And one more time. So back and forth with your hands, 3 to 5 times. So this next one I love. You're gonna take your hands and you're gonna cup it right under your baby's bottom, okay? And their arms, again, are gonna be kind of propped up on a pillow or on your leg here. And what you're gonna do is using this part of your hand, kind of that outer edge of your hand, you're gonna give a little bit of a pull down the spine. And what you're gonna see a lot of times is your baby kind of extending up. This is really great for these back extensor muscles. So you're gonna just pull down and feel your baby kind of extend up as you work your way from the shoulders all the way to the bottom with this one. Again, 3 to 5 times for your strokes here, okay? So we're working down towards the bottom. Good job, you guys. So then the next one we're gonna do are little circular movements. So you're gonna move along their spine. So if the outside of my pinky is the baby's spine, you're gonna use 2 fingers to make very small circles down their back like this. Okay, and I'm gonna show you here on my baby, on my doll. So little circles along their spine. So you're moving down one side of the spine in little circles. Good morning, you guys. Thank you so much for joining in. Again, we're going on infant massage on the back here, and we're working our way down in little circles on one side of the spine. And you want to do that 3 to 5 times, and then you're going to move to the other side of the spine and do little circles 3 to 5 times all the way down. And if you want to do one side and then the other side and then repeat that 3 to 5 times, that's totally cool too. It really doesn't matter either way that you do it, okay? The next move you're going to do are bigger circles. So with this one, I like to use all 4 of my fingers. And again, you're going down one side of the spine. Make sure you're not pushing down on the spine as you do this. You really want to be on the fleshy part of the body and not on the bones of the spine when you're working on these circles along their back. So you're starting up at the shoulder and you're moving down towards their bottom. Okay, 3 to 5 times. And again on the other side, 3 to 5 times. Perfect, good job, you guys. Hello to those who are joining. We're working on infant massage of the back right now. So we're doing large circles moving down the spine. Very good, you guys, perfect. Okay, and so the next move is a full body sweep. So with this one, as they're resting on your leg, you're gonna hold their feet in your hand, and with your opposite hand, you're gonna start up at the top of their head and just glide your hand all the way down their body towards their feet. And when you get to the feet, you're going to give just a little bit of a pull. This is, again, really stimulating for those muscles along the back of their body, those extensor muscles. So starting with the head and sweeping all the way down the back of their legs towards their feet. Again, these moves 3 to 5 times, okay? So the very next one and the last one for the back we're going to do is a combing or raking move. So with this, you make your hand kind of like a claw, and you're going to use the pads of your fingers. So you start up at the top of their shoulders, and you kind of give a vibrating combing motion as you work down their back like this. So your baby obviously will be in your lap, and I'm just holding the doll up so you can see how this one is. So you're combing down along their back. That's great. And then when you finish your 3 to 5 moves, it's always a great idea to lay your hands on your baby to let them know that you're done with that. Bring them up for a cuddle, and you can continue with the rest of your infant massage. So that's the neck and back for today. Let me know if you guys have any questions on that. And I'm going to continue on to our discussion on torticollis. So I know this is a really common word that gets thrown around a lot, and I can't stress enough that if you feel like your baby might have a sided preference or a flat spot on their head, please talk to a clinician, a pediatric physical therapist, or your physician about this so that you can figure out what's going on, because torticollis can be caused by a lot of different things, not just positioning, but it can be caused by things like vision or problems going on with the nerves, so you really need to get that teased out. And the earlier you get treatment, the better, and the shorter the duration of treatment. So it's a win-win for you, and it's a win-win for your baby. So torticollis, when we're actually talking about the muscle and the positional torticollis, we're talking about a muscle that starts right here in the front of your collarbone, and it inserts right here behind your ear on the base of your skull. It's called your sternocleidomastoid muscle, or your SCM, you might read about for short. And what that muscle does are 2 actions. It tilts your head to the side of the muscle, and then it rotates you in the opposite way. And you might see mine pop out right here on me as I do this, okay? And so that's why it can be a little tricky when you're looking at your baby. Okay, they're tilting their head one way, but they're looking the other. That's kind of confusing. A lot of times that's the reason why. So we really like to work on range of motion in physical therapy, and I can't stress enough, please talk to a clinician about the proper techniques for stretching. So I'm not going to discuss that today, but what I am going to talk about are some simple tactics that you guys can do at home. So with your young babies, try to change the position they're facing in the crib in the room. So if they're always looking one direction, that's going to be super stimulating for them. So try either switching the direction of the crib or switching the direction you're actually laying them down in the crib so that they get stimulation from the other direction. The other thing I want to suggest is making sure that you're trying to switch what side of the body that you're breastfeeding on or bottle feeding on if possible, because that way that's something that they do very often throughout the day. So if they can actually change that direction and change that position of their neck, that can be very, very beneficial for them. The third thing I want to stress is 10 minutes of tummy time 2 times a day. That does not need to be consecutive at all. You can do 1 minute here, 1 minute there. You can modify the position. Just think about where their arms are. Try not to have their arms way out wide. Try to help them get those arms underneath their shoulders so they can really try to push up. And I have a lot of information on that on my Instagram bio, so please check that out. So some of the exercises that I wanted to talk about today are active rotation. So that's how they are actually moving their muscles. So when your baby is laying down flat, the idea is you want them to be able to go from a position where they're rotated from the side to being able to hold that middle position. And then we want to be able to get them to actually track a toy. Okay, so distance is very important when you're working on engaging with a toy or engaging with mom's face. So early on, that 6 to 12 inches of distance is going to be really important. So if a toy is way too far out, they're not going to be as interested in it. Same with mom's face. If you can get in there 6 to 12 inches while your baby's laying down, it's a lot more stimulating for them to actually want to move and engage with that toy. Okay, so if your baby is starting off in the middle and pretend like my baby is laying flat on the floor. I'm just holding up to give you guys a better view here. So you want to start with that toy again, 6 to 12 inches right in front of their face, or using mom's face is very motivating. And you want to move in a rainbow arcing fashion when you're working on tracking. So a rainbow arcing fashion to the right and to the left in a nice slow movement. And when they hit that point where they can't go anymore, they might kind of fall back over to the other side, and that's okay. You can bring them right back to the middle and try again, okay? Another great way to practice is if they are having their head to one side, bringing that toy over to that side that they're looking at, and then again, moving in that arcing motion to the center to try to get them to find you or to move and follow the toy to that center. Okay, so those are some great ways to work on active motion, or when they are actually moving their neck. One other thing you want to look at when they're practicing this active motion, if they are preferencing a side, watch their shoulder, because as they move away from that side that they preference, you might see that shoulder come over with their neck as they start turning. So you can place their hand on their shoulder, so as they turn away from that side that they've been favoring, they get a little bit more of a stretch on that side of their neck. Okay, that's a really good technique that we use. All right, and so the last part that I'm going to discuss today is reach and grasp skills. So I had a lot of questions on how to get your baby to engage with toys and how to get them to start grabbing for toys. One of my favorite treatment techniques is called tethering, and I have this in my bio so you can find some videos of it. But basically you take a toy and you like a rattle, and you attach it to a string, and then you tie the other end of the string to your baby's wrist. Okay, and as they're laying down, then you give them a little stimulus, a little shake, and this causes them to start paying more attention to that side and start moving that side. So without them actually reaching for the toy, they start moving and purposefully moving, and then they start engaging more on that side, because you really have to link up the vision and the movement before they're going to be able to successfully grab that toy purposefully over and over again. Another really great way to work on reach and grasp skills is to start on midline control. So start on working on them holding toys in the middle. So if you just bring an object while they're laying down to the middle and bring both hands to the toy and just have them work and play and touch, that can be very, very beneficial to your baby. It also is really motivating if you're bottle feeding to have both hands on the bottle while you're feeding. So that's another great way to start introducing reach and grasp skills. So I hope this was helpful for you guys out there, and I hope everyone is staying safe still and staying home and healthy. And, my heart goes out to all of my friends in healthcare that are working so hard for us out there, and the first responders out there. So thank you so much for all your hard work. Please give me a follow at Boost Babies if you guys don't already, and let me know if you have any questions. And here's some information for y'all to contact me. I do in-home pediatric physical therapy and wellness. Right now I am also offering telehealth and virtual visits. So please don't wait for your next pediatrician appointment. There's help out there for you, and I'm here for you. I hope you guys have a wonderful, wonderful Friday. Thank you so much for joining me. Bye, guys.